Hello, so today I want to talk about symmetry. What is symmetry? It means that everything, the two halves of a shape are equal. Is the human body symmetrical? Well, you would like to think so, but not too many people have pure symmetry. If you take a face and look at the two sides of the face, hard level you find identical left and right sides. The left and right side of the body, for many reasons, birth defects, genetics, injuries, are hardly ever symmetrical. So the human body is designed to work in a certain way, where everything's in balance, everything's working together in harmony. And we all imagine that our bodies work that way most of the time. Not really. We are an accumulation of the injuries we had over life, of the scars we've had over life, of the asymmetries that we pick up over life. And these accumulate over time, and as you age, these accumulations start to pull your body out of shape. It could be something that's happened 20 years ago. An example might be a knee injury, happened when you're 15. You might start to feel problems in the opposite knee 25, 30 years later. What are the reasons for this? Any injury in the body creates an abnormality, creates a scar. It's almost impossible for you to get any joint, any tissue 100% back to the perfection you had when you were born. The reasons for this is your body has to heal it. Any healing process can't create the original perfection. It has to be a slight imperfection. It can be minute. Over time, an accumulation of movements, this builds up tension. It can build up asymmetry. It pulls your body out of shape. If you think how many times you put your feet down when you move, and again you're putting 3, 4, 5, 6, 7 times your body weight down through your legs as you move, this asymmetry, this tension can build up. Arthritis is a perfect example. Osteoarthritis especially, or wear and tear as GPs are keen to call it, is basically that. It's the joints, it's the surfaces, it's the cartilage wearing out. Now this may happen naturally, or may happen due to an asymmetry. Where this is specifically prevalent for physiotherapy is in the rehabilitation of injury. If you don't get an injury rehabilitated back to as close to perfection as possible, as time goes on, the slight weakness you have left, a slight decreased range of movement, a slight change in movement is going to build up and build up and build up and cause strain and wear and tear in the system. So take for example a wrist. Classic is a wrist fracture from falling on ice. The bones in the wrist are very complex in the way that they move. You may end up 3 months down the line, which is the average healing time to get back to a reasonably normal range of movement. You may end up with no pain. You may end up with no discomfort. Your subconscious brain thinks, brilliant, back to normal, sorted, off we go, and you don't pay it any more attention. However, without the proper knowledge, you haven't got that wrist back to normal strength. You may not have the absolute full possible range of movement back that you may do. The full healing process can take from 18 months to 2 years. You're not aware of that, it goes on in the background. Your brain just carries on. The physiology in your body just heals and heals and heals in the background, and this happens all the time, constantly. Cells in your body are regenerating every second, every millisecond as time goes on, and you're not aware of this. However, if you do not help that healing process back to the maximum you possibly can, you're going to be left with a weakness, you're going to be left with a decreased range of movement, you're left with stiffness, and over time this creates a chain. So that weakness in the wrist will have to be compensated for by working your elbow harder, your shoulder harder, your neck harder, and over time this tension builds up. And these are how you get elbow, shoulder, neck problems from wrist issue 5, 10, 15, 20, 30 years down the line. It turns into chronic issue that you can't recover from. If you put in the work at the start, if you're really consistent, if you pay attention and put the effort in, then you're going to have the maximum outcome. And that's what's really important from physiotherapy. We can give you all the knowledge that we can tell you what to do, we can put our hands on, we can do all the manipulation, massage, acupuncture, electrotherapy, as much as we can, but the eventual outcome is actually down to you, how much effort you're willing to put in. If you want the best outcome and the maximum benefit, you have to put the work in yourself. Thank you.